when he was in it,
Hmm.
how it would lead to Apple. But now looking backwards, he can see how the certain events aligned. So for example, like for me, I look back upon my life and I'm like, oh, that makes sense. Like, for example, when I was a research assistant in college, one of the medications that I was administering was ketamine.
Hmm.
And I was using it in an animal research setting, but I was administering ketamine. Um, and then if you think about which specialties use ketamine, it's mainly emergency medicine and anesthesia. That's where we
Yeah.
get the most amount of residency training of, how do I use it safely and how do I monitor, et cetera, for procedural sedation or operating room use. So there's another point for ketamine. And then when I was working in the ER, I saw a lot of patients with psychiatric um, challenges.
Yeah.
And so, for example, if someone is having a severe depressive episode or severe suicidal ideation, guess where they'll go? To the emergency department.
Yeah.
And so I was seeing a lot of these patients. And because there is a lack of mental health support, they would probably sit in the ER waiting to go to a psychiatric facility. And
Hmm.
so sometimes they would sit there for 24 hours or 48 hours or 72 hours just waiting for a psychiatric bed.
Oh.
And that was when I came across the first research study looking at ketamine. So it was published in 2000
Nice.
by a psychiatrist named Dr. Berman and his colleagues, where they were administering IV ketamine. It was a really small study, but they were comparing IV ketamine versus placebo. So just saline basically over a 40-minute period. And what they found was a dramatic drop in their depression scores in the
Wow.
ketamine group. And so I started reading into the science behind the ketamine and the evidence. And I was like, this is really interesting. Like, hey,
Hmm.
maybe we can do something in the emergency department to help all these
Yeah.
psychiatric patients that are having, their struggles. Um, but the medicine is kind of slow to change. And so at a certain point, I'm like, you know what? This is something that I'm personally really excited about. And I love also getting results
Hmm.
fast. That's one of the nice things about emergency medicine is
Yep.
sometimes there are some patients, they can come in, we can, fix their broken bone or pop in back that dislocated shoulder, or, they have some sort of irregular cardiac rhythm and we can fix it. And I loved that type of experience where we can make a rapid impact. And I felt the same way with ketamine,
Yep.
where we could make a rapid impact, maybe not in a couple hours, but over a period of like 1, 2, 3 weeks, like we could make a huge
Yeah.
impact. And that is personally just incredibly gratifying, especially for those patients who have been struggling for
Yeah.
years. And it's like, wow, we can turn them around. Of course, it's not every single patient, but the patients who do benefit, I really like seeing those dramatic improvements.
Oh, absolutely. Definitely. So for my listeners' sake, could you give them maybe the basic definition of what ketamine actually is and what it does?
Yeah, so ketamine is a dissociative anesthetic. It
Okay.
was invented in the 1960s
Hmm.
by Park Davis Pharmaceutical Company. They were looking for a medication that could be used safely for anesthetic procedures.
Okay.
Um, and what's really interesting is ketamine is a derivative of another medication called phencyclidine.
Mm.
And so phencyclidine was also invented by Park Davis Pharmaceuticals, also intended to be a general anesthetic, but it had all of these side effects. So
Mm.
ultimately, they asked a organic chemist out of Wayne State University. His name is Dr. Calvin Stevens. And so they consulted with Dr. Calvin Stevens and said, hey, can you make a safer drug than this phencyclidine that we have? And so he came up with ketamine and tested it. And ultimately, he found, yeah, this is really remarkable. It's a great anesthetic.
Hmm.
Um, and in 1970, that's when it was FDA approved for use as a general anesthetic in diagnostic procedures. So mainly, in the operating room. And how it works. One of the main mechanisms of action, and for those listeners who are familiar, it's works on the N-methyl D aspartate. So I'm just going to shorten that down, NMDA receptors in the
Okay.
brain, and it's mainly affecting a neurotransmitter called glutamate.
Mm-hmm.
And what is interesting about glutamate is that glutamate consists of 90% of the neurotransmitters in our brain. So,
Wow.
we have the other ones, serotonin, dopamine,
Yep.
norepinephrine, et cetera. Those only comprise a small percentage, but glutamate is one of the main neurotransmitters. And
Wow.
so ketamine is mainly working on that. Now, ketamine also has indirect effects on cannabinoid receptors, opioid receptors, a bunch of other receptors. So
Mm-hmm.
it's not necessarily like one single mechanism of action, but that's the NMDA receptor blockage is kind of the main one that it's most familiar for.
Okay. Now, does it also get like a bad like stereotype or a negative stereotype? Because I think it used to be called Special K, right? Used as a party drug.
Yeah, that's one of the most common
Yeah.
misconceptions that I face as a ketamine specialist is, ketamine does have a history of abuse. And and it was mainly popular, I think, more in like the maybe the European countries, maybe more of the
Okay.
Asian countries, not as popular in the United States, but it was still used as a drug of abuse. And people were using it as in a club setting, and even probably now. So yeah, it has that reputation as being, quote, Special K. It also has a reputation as being a horse tranquilizer, a cat
Mm-hmm.
tranquilizer. But it is true, it has been used on animals. So,
Mm-hmm.
veterinarians use it. Um, but what a lot of people may not know is that ketamine is one of the most commonly used medications worldwide for sedation.
Mm-hmm.
And the World Health Organization has it on one of its most essential medications that a healthcare system should have. And it's used ubiquitously through the ER and the OR. It's probably, as we're
Mm-hmm.
as you're listening to this, someone is receiving ketamine in a medical setting. So
Yep.
I would say it does have that history, but the vast majority of it is used in a medical setting. Of course, there is abuse of it as well.
And do you feel like there's a huge misconception that it's put in the category of like psychedelics at times when it's not?
Yeah. So ketamine, so it depends upon how you define psychedelics.
Okay.
So there's like classical psychedelics,
LSD,
which
MDMA.
are so classical psychedelics refers to drugs that affect the serotonin system. So
Hmm.
LSD would be one, psilocybin,
Oh, yep.
DMT, and then you have
Hmm.
the other non-classical psychedelics, which would be like MDMA. MDMA is actually a
Hmm.
methamphetamine based medication, and then ketamine is a dissociative anesthetic. So, but if you think about the word psychedelic,
Hmm.
and I don't know, do you know what the root of psychedelic is?
No, no.
So if you break it down into psych and
Okay.
delic, so psych referring to
The mind.
the mind, and then delic referring to manifesting. So mind
Mhm.
manifesting. So I would consider it not a classical psychedelic, but definitely with psychedelic effects.
Okay. And so when you're working with clients, you don't necessarily want them to have that psychedelic feeling when taking ketamine or
No, I
or
so I have a different approach to that,
yeah.
and I think a lot of other ketamine clinic owners do as well. So it's a feature, not a bug,
Hmm.
where potentially having those psychedelic, or I'm going to use the word dissociative effects,
Okay.
can be more beneficial. And there are some studies looking at this, that
Nice.
where when they administered ketamine, the more dissociation that the patient had, the more
Hmm.
robust the antidepressant effects were.
Wow.
In addition, some of the experiences that a patient can have can be quite spiritual or mystical. So they
Nice.
may feel like, hey, I'm having an out of body experience, or they may feel like they're seeing, deceased relatives, or they may feel
Hmm.
like they're floating in outer space, or even kind of like a near death type experience. And at the end of the day, when someone has that type of
Yeah.
experience, it can be scary. So not every
Hmm.
situation can be, it can be scary, but a lot of times if they can work through that,
Yep.
then it can be incredibly profound.
So if they, once they get through it, yes, it's like a nightmare, but when they come down, they gain so much from that experience.
Yeah. And I would say the majority of people probably wouldn't have nightmares. So there's something called this concept called